Thank you all for joining us today as part of Karsh Center's Caregiver Week. The Karsh Center is a nonprofit social service center located in Koreatown. We work with multiple amazing organizations and agencies and volunteers to provide free and low-cost services to the community. Some of these include food distributions, mental health services, legal aid, and more. This Caregivers Week program is really designed to highlight the health and well-being of the amazing caregivers in our community, address challenges due to COVID-19, and celebrate the remarkable caregivers in our families and communities. I'm so excited to get this panel conversation started. We've got an amazing, thoughtful, talented group here today, and we're going to try to cover a lot in an hour. Before we jump in, I'd like to extend deep, deep thanks to our panelists, Gabriel, Lauren, Michelle, Maggie, and Vicky, who will introduce themselves more in a moment. And I would also like to thank the amazing Jill Neiman, who was a thought partner in designing and creating the vision for this panel. All right, so that's our intro. And without further ado, we want to get to hear from our panelists who are here. So we'll take a moment to jump in with introductions. I'm going to invite each of our panelists to take a moment to introduce yourselves individually and give a brief overview of your organization, your mission, and the work that you all do. So let's start with Gabriel. Gabriel, would you take us away?
Yeah, thank you. My name is Gabriel. I am the Business Development Manager for Chrysalis. And what we like to say in our department is the mission within the mission is to help our partner access and retain great talent from our pool of program graduates. We are a social employment social enterprise where we focus on giving our clients the resources and tools necessary to find and retain employment. We do that in an array of ways. One way we do that is through our social enterprises, which we do transitional employment, as well as we connect our clients to outside partners through the local business community. And thank you.
Wonderful. Thank you so much. I'll then pass it over Michelle and Lauren.
Sure. Thank you. Thank you, Lizzie, and welcome to everyone. So glad to be here. Heart of Los Angeles, also known as HOLA, has been in this community for over 30 years, serving young people with an array of free and exceptional after-school enrichment opportunities. We've been helping young people learn and grow, and we have really had great success plugging young people into their passion, going deep with maybe music or visual arts or athletics or something, whatever they're interested in, but helping them to see college and career as a part of their future and supporting them in that way. We've got a college and career success department that supports our students as they apply for college with one-on-one mentors, academic support, and then assists them also as they go to college. I'm proud to say that for the last 10 years, our 12th graders have had a 90%, above 90% college attainment. And also our alumni, our students who have graduated and gone on to college, have had consistently above 80% 5-year retention and completion rate for college and university. And that attests to the personal relationships that we develop through the years, allowing each individual to grow and thrive. And recently, we have really expanded our capacity and our dedication to serving not just the youth, but looking at the whole family and seeing what barriers there are to success that we can help to address through family services, through counseling, social work, referrals. Karsh has been an incredible partner with us, bringing resources to our families. And I'm so proud to work alongside Michelle Sandoval, who is the director of our Family Services Department and has done heroic work, incredible work, especially through this crisis, supporting our families. And I'm happy to pass it off to her for her to introduce herself.
Thank you so much, Lauren. And hi, everyone. My name is Michelle Sandoval, and I am the Director of Family Services at HOLA. In addition to what Lauren mentioned, in seeing that our mission really was about empowering the youth and developing their potential. We've always worked to provide, holistic services with the family. But I think as we've seen that, and we've all seen that across the organizations that are present here today, it was more important during this time that we really provide services that supported the family as a whole. When we talk about strengthening the community, that means strengthening the nuclear family. And so we really, just revved up the programming that we have for our families and being able to support them in whatever is necessary and serving as a liaison to the outside organizations that also provide support. So it's just an honor to be here. And I want to tell all the parents that are present that, we are here to serve you and to support you. So feel free to ask any questions about any of the organizations in the chat.
Thank you both so much. Thank you. Maggie and Vicky, can we pass it off to you all?
Sure. My name is Maggie Bordeaux, and I'm a bankruptcy attorney over at Public Counsel. I've been practicing bankruptcy for over 20 years. We representing individuals who are thinking of filing for bankruptcy, file for bankruptcy, and also have litigation that ensues in the bankruptcy court. The mission of Public Counsel is the largest pro bono law firm in the country. We provide an array of legal services, not just in bankruptcy, but in immigration, homelessness prevention, veterans' rights. I encourage everyone to check out our website, www.publiccounsel.org. The services are free. And one of the specific focus that Vicky and I practice in is in the area of bankruptcy within Public Counsel's Consumer Rights and Economic Justice Project. And we try to assist people that are coming in with deciding whether bankruptcy is the appropriate decision in their particular situation, or they're in bankruptcy and are encountering some issues. We do know that with the COVID-19 pandemic, that has had a huge financial impact on families and small businesses. So we have been working feverishly to ensure that we have access to our clients, especially when the courts have been closed. And I can go into that more and answer questions how we're doing that. We provide, all of our staff is bilingual. And so services are available in English and Spanish. And we also work actively with the courts in order to ensure that access is facilitated, especially for self-represented litigants or indigent litigants or individuals that don't have limited English skills within the bankruptcy court. We are happy to be invited today to speak to everyone. We have been partners with the Karsh Center from the beginning, and we really appreciate that this is one more way to reach the community. I will now introduce it to a very valuable team member. She is the paralegal for our bankruptcy project and is on the front lines, sometimes the first contact to Public Counsel's Debtor Assistance Project, Vicky Padilla.
Hi all, my name is Vicky Padilla. Like Maggie said, I'm the senior paralegal for the project. We do assistance at the bankruptcy self-help desk and also bankruptcy workshops here at the Karsh Center. I noticed that someone on the comment section listed that they would like more information on how to contact our firm. So I'll go ahead and put that, I believe, later on. Thank you again, Lizzie.
Yeah, absolutely. So I want to thank you all for the work that you do. And for our audience, we will be putting all links to each of these organizations and resources for how to get involved with them in the chat at the end of the session. We might have an audience member to some of our admin team who can add some of those links now as well, so that you can start exploring some of the resources that these amazing groups have to offer. So each of you kind of started to reference this. I think it's something that the last year is one different than any of us have ever faced before. And looking at, each of you have started to reference sort of how your work evolved in the last year to meet these needs. And I was wondering if you could take a few minutes to share what, on an organizational level, has the last year looked like for your organization? And then as far as the work that you're doing with the community and clients, what are some of the biggest overarching needs and experiences you've been hearing about from the specific families and communities you engage with? Specific to COVID, as far as, health impacts, but also these secondary effects of COVID that have come from our city changing in the way that it has. Michelle and Lauren, will you kick us off with that?
Sure, yeah, happy to. Well, obviously, the major pivot was to remote program delivery. And so right off the bat, we needed to make sure that our students and our families were connected to technology. And so luckily we have a scientific arts department with a robust knowledge base who were well versed in working with students and with families already at that point, and just helping them to do some troubleshooting, getting the proper technology in their hands, and helping them to do any repair work that needed to be done just to make sure that they were connected. Computer has been a lifeline for everyone over this past year, and just making sure that they weren't left out of the mix there. Distributing Wi-Fi hotspots and things like that. And then pivoting to delivering our services remotely, making sure that we captured the same feel that we have. HOLA is really known as an organization that connects on a personal level with our clients, with our students, and with our families, making sure that through technology, we still have that feel, and retooling our programming to make sure that not only do students feel connected with us, but also with each other. And that has been a major core value that we have tried to impart and deliver, is helping our community to feel connected with each other, students feeling connected with each other, and families feeling connected with each other. We have usually a very robust lobby with our families, our parents, with a very active social scene amongst them, and mutual support. And Michelle has done an incredible job of replicating that online, and in fact, even growing it. I think that our parent community is now stronger in their connection with each other than they have ever been through a lot of the services that we've provided. I know we'll get into next steps, but returning to in-person is the next thing that we're looking forward to, and helping people to connect in that way. So I'll hand it over to Michelle. She can talk a little bit more. That kind of covers our program delivery model in terms of student services. But as I said in my introduction, it's been a major pivot for us. We usually have someone in a position like what Michelle is serving in right now, that once was a part-time position, helping our families to find resources when they're in crisis, making sure that they can navigate through the systems, things like that. And through this past year, we've gone from some of our families to being in crisis to all of them. And so we knew we needed to respond by really adding staff to that department, and strengthening it, and helping our families to get through this crisis. And Michelle has been incredible doing that, and building a team to help support the families. And I'll hand it over to her to talk a little bit more about what those efforts have looked like.
Thank you, Lauren. So I think when we address the shifts that happened, or the changes in meeting needs, right? I think it's important to acknowledge that, you know, being on campus, like Laura mentioned, it's a culture. There's nonverbal cues, there's a community. And in order to recreate that, it did take, you know, I think that the biggest thing that we have implemented and have as an organization really done from the beginning of the pandemic was the feedback loop was literally the fastest that we've ever had it. It's and also, you know, seeing what was working, what wasn't, and where the needs were. I think in the past, we focus on the academic enrichment component where it's programming, right? So developing the curriculum, but we are addressing the family's needs. And in this case, it was literally getting information from the families and kind of being 2 steps ahead of the crisis, even though we were in the middle of a crisis, and bringing those kind of programmatic, we always say that we like to be proactive and try to not be reactive as much, because if we are proactive in bringing those programs, then it supports more of our families before we're at full crisis, even though we saw that. And just really being there for them in that way, in addition to, you know, the other kinds of support that we have. We really strengthened our relationships with community partners, and we appreciate all of our community partners who have stepped up and said, okay, we can help your families. We reach out, and you know, that like Laura mentioned has really been strong. But I think in terms of the community, the organization, the way that we've acknowledged the needs and the feedback loop and all hands on deck, identifying, being very observant, like we turned into a very vigilant, observant in a good way kind of staff, because we said if we monitor that now, maybe, you know, a week from now, we won't hit full crisis modes on certain families. And so it's really stepped up our game in terms of predicting and having to adapt. So the feedback loop has also caused us to adapt as we go. And, you know, Lizzie, the types of topics that you asked us to identify, we used to focus on academic enrichment with, you know, providing them services with HOLA, with, you know, legal aid, the public counsel, referring them to just whatever they need. But in this way, the programmatic side for all different topics, we saw a surge for housing, for legal aid, for immigration resources, for food insecurity. I mean, all those topics that tend to sometimes go under the radar. You might just have, you know, a handful of families, and we address them in addition to the academic enrichment. It really became priority because the student cannot thrive and be present in our programs without the support to the families. And that was really what we needed to do urgently. And we're happy that we were able to adapt in that way. And I'm really proud to be a part of the HOLA team, and our families are just resilient beyond imagine, you know.
Yeah. Thank you. I mean, the Karsh team has certainly appreciated getting to work with you all as part of that pivot and that adapting. So thank you for all that you're doing. Gabriel, can you share with us a little bit what the last year has looked like at Chrysalis, and you know what you've seen happen in the employment space in the last year?
Yeah, so at Chrysalis, what we looked at was how do we get our clients through the program more efficiently. So we wanted to expedite that process. Well, even prior to that, we shifted over to remote services, as Lauren and Michelle mentioned. And part of that was making sure that they were connected to the Wi-Fi, getting them, you know, laptops and computers or smartphones, and making sure that we can get them connected to their employment specialist so they can get the support needed as they're going through our program, completing that program. And some of the areas that we looked at was how do we help with childcare and transportation, and how do we provide them resources? So we were able to provide up to $1 million of funds to our clients in areas that were needed for rent or groceries or what have you. So we wanted to make sure that we looked at them as a holistic approach. Workforce development and employment is one area, but as you all are mentioning, it's really looking at the whole person, the family, and figuring out what resources they're needing to make sure if a client wants to go and work, if an individual wants to go and work, we want to make sure we give them those resources. And one of those areas was through the Project Room Key initiative. So we were able to employ many of our clients in that area, as well as provide housing to a lot of our clients as well. And they were getting paid, $18 an hour, which was a really good wage. And many of our clients are going into these sort of entry-level jobs. So we know as the minimum wage increases, that's obviously a benefit, but looking at how do we upskill our clients. So, some of these opportunities like Project Room Key, as well as through our social enterprises, we looked at how do we ensure that we don't term them out. So many of our transitional jobs are limited. So we stopped those, and we wanted to make sure that anyone that was able to work was going to continue to work, because we didn't want them going out in that environment during COVID where things were uncertain and there weren't many businesses open. So we were able to keep a lot of our workers through these transitional jobs, and just figuring out how to maintain and prevent homelessness through some of the rent prevention or the payment prevention practices. So we were just looking at a lot of those areas to make sure that they were going to be able to keep their jobs, because obviously long term we want to make sure that they were able to achieve self-sufficiency. And as we're looking at shifting over to post-COVID, whatever that looks like or when that happens, that they were able to maintain employment throughout that time.
Thank you. And I know, I'm hearing, and we've talked about this, of the also the lack of physical space initially really being a barrier. So again, seeing that tech pivot being, it sounds like, is as critical as we might suspect.
Absolutely, yeah. There's that digital divide a lot of our clients face, and some of them are coming out of incarceration or experiencing homelessness, and it's just such a huge need. And some of our clients don't know how to use computers or phones and things like that. So it's really starting from the ground level up to make sure that they're successful, and we're able to do that successfully.
Thank you. Vicky and Maggie, will you, sort of thinking through that economic lens and what this has meant for, we've talked about the self-help desk and access to the courts or lack of access to the courts. What has your last year looked like?
So we tried to be not reactive, but this year has been nothing but being reactive, because when COVID-19 hit, we had no choice. We had to pivot everything into technology. So at the very beginning, and the pivot to technology was not only a transition to reach our clients, but it was also a transition for staff working with each other. So you had both of those transitions happening at the same time, some smoother than others, but both were challenging for different reasons. Also, a lot of people working from home were setting up their home offices. So that had its own challenges, along with many people, their kids weren't going to school. So there were just many layers of challenges that people were at Public Counsel, and me included, were facing both, at home and trying to work from home, and while still being able to have the services available for our clients. So I would say technology is the big sort of a transition, because we value being able to see people in person. We do think that makes a difference, but we just had no choice. The courts were closed. And so the first thing we did is we did a remote intake so that individuals could go to our website, apply for services in English and Spanish. But we quickly realized also with some of the transitions that we had to also confront when technology did not work. And that was one of them, because obviously people will have to know about our website. I'm sorry. Oh, I thought somebody said something. So of course we had to also face when technology did not work. And so what we ended up going back to is opening back our phone line so that individuals could volunteer. So we got volunteers, we kept it remote, but what we had is people then call people and then do their intake remotely in English or Spanish, because we found that there's many people that either weren't familiar with the technology to go on the website and do, or even if they could, for many of our clients that are elderly, Spanish speaking, monolingual, filling out an intake for us may seem routine, but for many of our clients, that can be pretty challenging. And so we didn't want them to fall through the cracks. So we did both. We said, if you're able to, and it's faster, we have it on our message, go to our website, you can do our intake. If not, leave a message, somebody calls them back, we then assist them manually. Now it takes more time, but we found that it actually ended up being a good idea, because we had and Vicky can correct me if I'm wrong, but it ended up 60 to 70%, especially at the beginning, were leaving messages. That would have been 60 to 70% of our clients that would have just not, went away. So we were very fortunate that, we made that decision early on. And that was actually a suggestion Vicky made, because she was realizing a lot of people were having trouble on the website or didn't know, how to get there. So we were able to quickly act, get volunteers. So that was the first thing. The other thing is we then started doing a lot of educational videos. And one in particular, we have monthly hearings at the bankruptcy court in both the LA and Woodland Hills divisions, where we provided counsel and advice in person. Now we couldn't do that. So we developed with the court educational videos, both in English and Spanish, that people could watch. And then we would be joining via Zoom to give the counsel and advice. So we tried to make it as much as it would look like in person, given the remote access, and also enable clients to still have the capability of, it's not just an informational video, you still get the access to be able to ask questions. So that was another valuable thing. And the reason we were concerned about providing as much access as possible is we were concerned with a lot of the bankruptcy petition preparers or notarios notarios or, people out there that were going to soup people up because they realized there's no attorneys out there on the front lines. And so we worked very closely with the courts to say, okay, when people are coming, make sure that you give out our flyers, which you will get at the end of the program. And so we really made an aggressive effort to make sure that we got ahead of it. We knew that because of the rent moratoriums and mortgage, a lot of things were being pushed back. Either the courts were being closed, people couldn't file, creditors couldn't file lawsuits. So we knew we had to take advantage of this limited period of time to get up to speed, because we knew once those are over, we were just going to get slammed with people thinking, I need to file today, I need to file tomorrow. So we wanted to put everything in place so that those were already in place. The other thing that I will touch upon is just the disproportionate impact that COVID-19 has had on communities of color. And typically because they were the individuals that were mostly on the front lines. At the bankruptcy court, 85% of people that access are the language line put on by the U.S. trustee are Spanish speakers. So then we already knew, based on our demographics that we keep, that African-American communities and the Latino community disproportionately access our services. We'll compound that with COVID-19 and the financial impact. We knew that was going to go through the roof. So we made sure that all of the efforts that we had in partnership with the bankruptcy court, at Public Counsel, any information, and Vicky will attest to it, we try hard. Everything has to be in Spanish. And believe me, sometimes it's not easy because, it takes time. It takes time to slow down courts, to slow down judges and say, wait, did you translate? Give us time to translate that in Spanish. And with so many things coming everybody's way, it was really invaluable for us to be there and say, wait, but that's not available in Spanish. And then we'd get, well, we don't have anybody. We'll do it. Give us the notice. We'll translate it in Spanish and give it to you. I can't tell you how many times I've given Vicky, can you translate this by next week? Otherwise, we can't get that notice out to the court. And the courts have really appreciated. They're also dealing with sort of the same things we are, only on a bigger scale. So we have really honed that issue on the front line, because we know how many Spanish speakers are going to both need bankruptcy advice, but also they are the prime targets of notario fraud, bankruptcy petition preparer fraud that we see. And we didn't want them to get victimized, especially in light of all the tragedy already occurring with the COVID-19 devastation. So I will end there because I want to give Vicky a chance to say a few things.
Sure. Like Maggie mentioned, the implementation of volunteers and the recruitment of volunteers was very important for us. As a 3-person team, we were trying to handle several different, callers and intakes. And I think the implementation of volunteers, being able to perform those intakes over the phone with clients that typically would have gone to, a library to access the internet, access the computer to complete those intakes. Like Gabriel said, the digital divide is very real to the communities that we assist. So I think that was something that was very important for us to be able to implement. And, I think one thing that was very important to us was to make sure that the issue of access to justice for our clients, was solved in some sort of way by us being able to implement different types of systems for them to be able to access us. But yeah, I'll end it with that.
Well, I'm really interested because I think across all 3 of these programs, and we're all seeing that, I don't know if gap is the right word, but the space, especially that existed in the beginning for what it meant to go digital, when we know that lack of access is such a significant component of our work and working with our communities in the beginning. I'm wondering if you have seen, and I guess quickly, because I want to get us forward looking soon too. I'm wondering if you all at your organizations have seen a shift in your clients or growth in your client base or the families you engage with. If you're serving different populations than you were before, or you're seeing folks come to you. Maggie and Vicky, you've talked about the mechanisms through which folks are coming to you, but just wondering if your client and family population has changed at all in the last year or grown in any way.
Well, I am glad you raised that because Vicky did some amazing research that she's going to share with us on stats.
Yeah, so I pulled up basically all of our stats from the period where we went into remote work. And you were able to see a correlation between, head of households reaching out actually to our services, which is something that we hadn't typically seen before. And of course, that came with people that primarily had lost their jobs, had their work hours decreased, loss of child support and alimony because their ex-spouse lost their employment, or loss of just side jobs, like Uber, Lyft, crafts, freelance, lawn care, gardeners, childcare providers, in-home providers. Acting and film was, I think we saw a pretty big increase in the entertainment industry clients reaching out to us because they did not have any, work. Also, single parents with children at home after the school closures, and they weren't able to put as many work hours because, they didn't have a childcare provider anymore. People with health issues that were at risk, also main head of household income providers for their elderly parents. So this was like adult children that lost their jobs. So now the only source of income in their household was just their, Social Security from their parents. And I think that was just such a huge shift, especially with people that have, medical prescriptions and stuff like that. So we definitely did see a shift in the clients that reached out to us. And like Maggie mentioned before, we implemented, our message line and doing over the phone intakes with clients, we had definitely seen a decrease in a lot of our elderly communities. So, over 71% of the clients listed that COVID-19 had impacted their financial situation. And most common reason given was the impact was loss of employment or decrease in work hours. Yeah. People were working 2 jobs and didn't feel safe to continue working. And even one person listed, they didn't feel safe continue working at FedEx because they live with their elderly at-risk parents, and which meant that they had lost 24 hours of work a week because of that. So that was some of the information that we were able to pull out, but also, 59% of the people reaching out to us were female, 34% Latino, 29% white, 19% African American, 27% listed a disability, and over 247 people listed that they had $0 from employment income, and their average household income had dropped to about $2,000 a month. And this was for households that were larger than, just single family household sizes. So this was, people that ranged between 2 to 5 people in their household, and their income had now gone down to $2,000. And 58% of those people responded to receiving government benefits, which primarily were from food stamps, Social Security, unemployment, disability, and again, averaging only between $2,000 to $2,500. And as we know, rent and home values here in LA have reached amounts where people are not able to afford that with just $2,000 a month, and still being concerned about food and groceries and, any other type of medical expenses. So that's a definite shift that we saw in our population. But yeah.
And I will add just one last thing. Thank you, Vicky.
Yeah.
That was amazing information. The one thing I will add is also small businesses. I've seen an increase in requests from community-based organizations that service small businesses. And I do anticipate, I've already seen the cracks now where people are wondering well, should I declare bankruptcy? What do I do with my business? The rent hasn't paid. I don't know what to do. The landlord won't negotiate my lease. So I anticipate that's going to be the next wave of clients that we're going to see.
Gabriel, Michelle, Lauren, is any of that are you seeing similar impacts in your population and community?
Yeah, I think at Chrysalis, just real quick, we did see a younger client. Our average age is about 38 to 40. So we did see a little bit younger in terms of our clients, as well as an increase in female clients. An increase in those not currently experiencing homelessness. So similar to those that are in multiple family homes, as well as self-referrals went up, and then our referrals from agencies. So there was a big shift from our average age, as well as we're predominantly male in terms of our clients. So it did shift, and as well with the female clients, like Vicky was mentioning, they're at home, they have children perhaps, and there's that issue with trying to figure out how to work from home and maybe not having a computer or access to internet, and employers are looking at Zoom calls and different kind of compounds in terms of some of those issues. So some of those areas we try to fill in.
Definitely. Thank you.
In terms of our programs and our students, I'll let Lauren talk about the impact that it had on our student population, but I wanted to also highlight how it affected our families from the parent perspective. When we have these kind of programs throughout the year, prior to the pandemic, we would host them in person, obviously limited to the capacity of a room. As we overcame that hump of the adaptation to technology, we realized that there was a high need for a lot of access just to information, to resources, and we started hosting different kinds of workshops and just testing them. And for example, we have always had a partnership with D.D. Hirsch Mental Health, and we started launching these an adapted version of a series with them. And we were able to extend that opportunity to several partners. We started small, we extended to, let's say, Karsh, for example. We also extended to a few schools, and we saw, parents coming in from those populations of those companies, organizations, and really taking advantage of the access to these virtual workshops. So with that, we just, continued doing it, but now we have a succession of different programs. I would say about 10 different topics that are ongoing, and they're consistent, that we've extended to our partners that are in the neighborhood, that are, the schools, the organizations that support. And so I think from the parent perspective, it's allowed us to reach and really expand our reach beyond our traditional families that we've served. Typically, like a school, for example, where you enroll in our programs, we, follow along with those families and we support the students. But in this case, it was, we have the students, but if you know of anyone who wants to come to this presentation, we actually did a presentation with Karsh on scams, and just because we saw that there was a surge in identity theft and the potential of, different scams and thefts that were happening virtually. And we had our partners at Badzedic present for us, and we hosted that virtually, and we had participants from different organizations who just found out and wanted to attend. So being able to serve them in that way and has really opened up the doors for what we've been able to do. And we plan on continuing that beyond, once we return to in-person, because we saw that just providing that for the community as a whole. In addition, we've done, legal services. We have an immigration reform update kind of presentation coming up with Medi-Cal enrollment. So it almost made it seem like the boundaries that were there before are now limitless, and we can continue serving our students and their families and their families, friends of families, right? So it's been really good for us to see that.
Yeah, I would, that's wonderful, Michelle. I would add that there have been a few silver linings like that, where we've been able to expand our reach to families that aren't necessarily enrolled in our programs through our partnerships and workshops and things like that. Our program outcomes are really accomplished through longevity, through long-term relationships. So we haven't really expanded our client base that much. We've really gone more deeper in serving the students and the families who are our clients. The example that Michelle gave of the workshop that we did on scams, that came through the depth of connection that we were seeing with our students, where there was one high school student who alerted their teacher and said, my parents are getting involved in this multi-level marketing thing. It seems a little fishy to me. Can you all look into it? And they sent us the information, and we reached out to folks in the city attorney's office. They brought in their consumer protection folks and investigators, and they said, yeah, we can see that this is definitely a scam. This is fraud. And we were able to then connect back with that student, but that opened up an opportunity to say, you know what, this is maybe just one sample, and there's a lot more going on. And as soon as we put it out there, there was so much interest in learning about that, because there's so much predatory, people trying to take advantage of people in a desperate situation. Another silver lining that we saw is that our students are becoming the parents are much more tech savvy than they were before. We're seeing our youngest students really knowing their way around a keyboard and knowing how to operate things like that, and that's going to be something that's going to benefit them and us long term, along with the parent classes and workshops that we've offered. Our college access programming, which is mostly seminar style, we have had much stronger attendance and retention in that program because it's easier for students just to tune into something rather than having the transportation needs, especially high school juniors. It's such a busy year academically, being able to just tune into something, get the information that they need, connect with each other. I think that we're going to keep that mode of delivery when we go back to in-person and have both of those and expand our reach, doing asynchronous programming in visual arts, in college access, where we're going to be able to share the information that we are able to deliver through programming with a much wider audience.
So you teed me up perfectly, because I'm wondering, sort of, thinking about that and like what pieces you'll hold on to, but also this looking ahead. We could spend many sessions on this, but I think to get started, like we're on the brink of transition in so many ways. We've got schools reopening in different ways. We've got, I think, in LA, a lot of businesses reopening and expanding in different ways. And of course, we see the reopening of the courts in different ways, potentially, the eviction moratorium coming down and what's ahead in the short term. I'm wondering if we could take about 5 minutes for each organization to share, like, what are you seeing as these short to midterm changes up ahead? And how might you be starting to prepare or address those? Do you want to kick it off, Lauren, since you teed me up for that? Do you want to take it away?
Sure. Yeah. I mean, the most important thing for us right now is helping students and families to access in-person programming. And so one of the things that we did, knowing that our community is very much under-vaccinated, and hence very much underprepared to be safely re-engaging in those opportunities, we conducted in collaboration with Kedron Health and with Karsh and other partners, a community vaccination clinic just a couple of weeks ago, where we were able to vaccinate over 700 community members. And we're happy to be able to offer a second dose clinic coming up on May 22nd that we will share with you. It's not just for second dose, but it is timed for anyone who came to that first event, whether they got the Pfizer or the Moderna, to be able to do that. We're also really excited to hear the news that 12 and older now are eligible to receive the vaccine. So that event that we're going to be hosting on May 22nd will be able to vaccinate our middle school and up students, and that will be open to the community to help families as well as family members. So we're just excited, but we know that there are obstacles. The employment issue is really complicated with families returning to work to a certain extent, and the complications that causes to be able to access different programs and activities. And so we're trying to work with them to try and be flexible, make sure that we can offer those opportunities, but being sensitive to the fact that it may not be as easy as we imagine for them to take advantage of them. Yeah. Michelle, anything you would add?
I think you covered most of it. I'm going to drop in the chat our link to our Facebook page, where we will share the flyer for it. So I want all the families to be able to access that and sign up. And we're just excited to be able to support the families in this way. And I'll share a small little tidbit that when we hosted the first vaccination event a few weeks ago, just seeing the families, and a lot of them said, like, we didn't know if we were going to get vaccinated. We just didn't know if we felt safe. But then we saw our HOLA staff, we've been vaccinated for weeks now. And also the welcoming within our community, saying this is for you by us. And so a lot of our families showed up And it was just beautiful to see just the trust, the depth of the relationships really allowing us to leverage that and provide them this opportunity to get vaccinated, sooner and easier in a way that just made it so accessible for them without them having to wait in these, long lines and things like that. So we're really looking forward to having it again on May 22nd, and we look forward to everyone coming. And so I'll share the link in the chat.
Wonderful. Thank you. Yeah. So proud to be part of that and excited that that can be a resource for the community. Gabriel, what are things looking like at Chrysalis in this next phase of reopening?
Yeah, it's gonna definitely be a challenge. We're still gonna be using some remote services, so we're gonna do appointment only as we add more in-person services. So as they go into the office, we're gonna set up desktops and have our clients communicating with their employment specialists that way, and making sure that we're looking at probably July as we're going to be adding more in-person services. So just kind of dealing with some of those challenges and figuring out the logistics of all that. And in tandem, what we're hoping is that the economy opens up slightly more. We've seen an influx of restaurants coming and reaching out to us, and they have tons and tons of openings and needs currently. And so as more of our clients, hopefully we're getting more and more vaccinations, and more comfort with going out back to work, because there's still that fear of COVID. And so just trying to figure out how to manage those expectations as more and more of those employers come online, and being able to connect them, get them through the program, get them ready, and hopefully, get into those jobs as soon as possible.
Great. Thank you. Thank you so much. And Maggie and Vicky, what are the next couple months looking like from your standpoint?
So I will, I'm going to do a little backup to the scams. If anybody, because we were actually thinking that the scams, and this came to a surprise through a program that Vicky attended, we thought it was going to be financial crimes, identity thefts. I just want to say, if you're looking for a program to do romance scams, that came out to be from the FTC, the biggest detriment to people out in the community. I don't have the numbers in front of me, but if you want that information and you want a suggestion for a scam program that I think is important to put on, we were surprised. We thought it was going to be financial scams, or I've been very keeping my track on the Social Security, like people calling you from government agencies saying call and buy these cards or whatever. Yeah. But we were actually surprised that the romance scams dwarfed all of that. And so just throwing it out there. But anyway, so how will it look? So how will it look like? COVID-19 hasn't, a couple of benefits have come up sort of collaterally, which is, we have been able to work with the courts to try to provide more services remotely. And one area in particular that I'll focus on, just as an example, is we usually have these monthly reaffirmation hearings in Los Angeles and Woodland Hills. Now, people would have to drive miles, sometimes having to use public transportation, pay for parking, stand in line, go to court where it's intimidating. All that got switched during COVID to be done by Zoom. And it actually turned out much better for our clients. And quite frankly, much better for staff. Rather than it taking us a whole half a day, sometimes the whole day, to attend these hearings, Vicky and I are able to get online, see our clients. I was actually also able to counsel clients much more closely, because I didn't have the rush of 20 people in the courthouse. They were in the courthouse. You get put in a separate Zoom room, and it was just me and the client. And I had never had that. I mean, Vicky will tell you, when I'm in court with 20 or 30 clients managing volunteers, I try as best I can to individually focus on the client. But, Vicky will tell you, I'm sometimes with a client, I'm being pulled in with a volunteer, I'm pulled in with the court because something's happening with the calendar, there's been a change in the courtroom. And so that's just one example of something that we definitely advocated for the courts to keep, even as we reopen. So I think we also worked with the court to do a survey to attorneys, because this is also costly for the attorneys. If the attorneys have to make appearances that are costly when they're routine matters, such as, at the beginning of stages of any litigation, you have status conferences or appearances that, they're pretty routine and can be pretty easily done through a Zoom, appearance. Well, that saves the attorney money. And if these attorneys are able to save money, that saves clients money. And so, because they don't have to charge as much. So I think there's a whole rethinking. Now, I'm not saying technology is the answer for everything. I definitely think that there is room to still keep the in-person aspect, but I think that this is the time to take a surgical approach to see where does it work and work even better. Where does it work? And it's sort of, it's sort of break even point, but on the whole, it's more convenient. And where does it not work? And I think this is the time to do it. So I just wanted to highlight a couple of things for, I'll turn it over to Vicky.
Yeah, sure. I mean, we've begun to do Spanish bankruptcy workshop overviews. And so that's something, a change that we felt was necessary. But prior to even COVID, we had also transitioned to providing, sort of remote access to our workshops that we have in person at the Karsh Center before, because we had seen parents that had young children that couldn't go to our workshop in person. And, if they were a new mother having to step away to breastfeed or anything like that. So now with the option to be able to have these workshops also remotely, I think really assisted a lot of our clients coming from Lancaster, coming from Palmdale, having to try to find, parking or anything like that to our courthouses. So I think this is something that we see ahead. I mean, we're trying to make sure that we keep in the loop in regards to the rent moratorium, because we know that that's something that's going to affect a lot of our clients, and really making sure we have proper referral lines of communication amongst, the other agencies that we work with, so that people are not just shuffled around through different agencies in a time of crisis for them. So that's something that we're definitely trying to work on and make sure that we have sort of different, aspects of it set in place so that people in a time of crisis are not, being sent to one organization that doesn't, handle that type of issue. So I think that's something that we're really trying to see ahead to make sure that we're prepared for a surge in clients that, might need our assistance, and really being prepared also with volunteers. I think our firm in itself really depends in the work of volunteers, and, they provide a great service to both our firm and our clients by being there.
I will say one last point with regard to bankruptcy. I mean, and this is going to be affecting all our organizations, which is some jobs are just not coming back. And that's something sort of, it's not a bankruptcy issue per se, but it's a systemic issue. I mean, we in the bankruptcy field saw that coming with the fall of the retailer, Amazon. People's buying habits are changing. So we are seeing sort of a shift with the way people do business, with the way people do work. And I think it's going to have a huge impact, especially in some of the communities we service, because when the pandemic, there were some jobs that could be done remotely, which was fine. There were some jobs that couldn't be done remotely. And then there's some jobs that after the pandemic, we're not sure are ever coming back in certain industries, because those industries were already shrinking before COVID. So for what we saw in the bankruptcy field is COVID-19 was mainly an accelerant, but it really to something, a trend that was already happening. Now a year later, most people were buying things on Amazon. Well, that trend was already starting. Now with COVID-19, it just accelerated to the 19th degree. And so a lot of those jobs, I think we should just remain cognizant of the growing gap between the haves and the have-nots. And many of the have-nots, of course, are our clients that we service, but that gap is going to be a lot wider when COVID-19, even as the economy opens, because not everybody's, what I'd like to say is, I'm working on an article is we're all facing the same storm, but we're all on different boats. So some are, on luxury liners and some are on rafts. And once the economy starts picking up, it's not going to pick up for everybody. Sorry about that. Not so cheery note, but.
No, but honestly, and it's, I think that's the point of this conversation, right? Is for us all to be in conversation about this, knowing that, in these spaces, we work in these spaces to address the gaps that exist. And I think that is the goal of this conversation, is to understand that that gap is widening in the recovery. And so how are we able to, and again, this is, I think, where we have several more conversations coming after this, but how are we able to stay mindful and focused on what we as a community and multiple communities in the city and a county are doing next, to care for one another in this recovery and have it be really one that includes all of our families and the individuals that we work with. I don't think there's an easy answer to that, but it does, my last question for this group, and then I want to give a few minutes to anyone in our audience. If you have had questions come up throughout this session, if you would drop those in the chat, that now would be a good time to do that, because this is my last question for the group, which is looking forward at your work or the work that you're doing in the community, or that some of the families you serve or the students you work with are doing in the community. Are there any particular points of focus, whether that's bills or conversations that are happening or movements that are being organized as a group, that we as community members and neighbors and social service organizations should be paying attention to and really focusing on to stay focused in this recovery process? Gabriel, you mentioned the minimum wage conversation, but I don't want to plant that seed if that's not what you would have said. But any one kind of takeaway idea that we would want everyone listening to this call to really stay focused on moving forward?
Yeah, I think looking at Upskill, additional training, as Maggie was mentioning, the economy is going to look a lot different. So figuring out what opportunities are out there and training to those sorts of jobs. So, Chris is looking at different areas of high growth industries, figuring out how we can connect our clients to move from those entry-level jobs to those mid-level jobs. And that's going to take some training. It's going to take some time and effort to find those right resources, as well as looking at how are we looking at hiring practices. We help those that have backgrounds. So how do we look at those sort of dynamics, as well as some employers are rethinking their drug testing as relates to marijuana. And so just figuring out different ways in which we can connect our clients to these opportunities, and really, talking to our partners to figure out how do we do a better job of getting some of the folks that you may not typically hire into these sorts of jobs, and making sure they're able to upskill once they get to those partners. So just really looking at those sort of dynamics and rethinking how we can look at those hiring practices.
Awesome. Thank you. Jump on in.
I'll be very quick, only because Gabriel already touched upon my biggest thing, which is job retraining and making sure that we're training people for jobs that provide a livable wage. I mean, there's plenty of jobs that don't, and those are not the jobs we want for our clients, because then they end up with me. So I'd say that's number one. Number two is housing. Anything that can do with increasing affordable housing. And number three is healthcare. As we saw with the COVID-19 pandemic, a lot of the times certain communities were impacted because they just simply didn't have the access to healthcare. And if we had, this is not to get on my soapbox, but if we had a national healthcare that was more, that got involved much early in the process, we could have saved a lot of lives. And unfortunately, that's not the case. And that still is an issue that needs to be addressed, not only for, a possible pandemic, but just any issues that are of health that impact our community.
Thank you.
In addition to what's already been mentioned, we just saw a surge in interest and need for mental health support for, in the sense of community grieving, individual grieving, addressing it, and providing our families and our parents a way to stay happy and sane and enjoying the little moments as small as they could be, to really get us through what was a very, very difficult year for a lot of our families. And that's something that I just want for all of our participants to know, that there are resources for adults, there are resources for children. A lot of the times you don't have to know what you're searching for. You just have to ask the right person and say, where can direct me, and you will have someone who cares, like the colleagues that are on this call. But it's important to ask for help in that way, and to also find center in your own self. In contrast to what my colleagues here said, I think that's very important for those tangible kind of things, but also the non-tangibles, which was feeling safe, feeling love in your family. And we just had to get very creative as to what that meant, and helping our parents, empowering them with, creativity and tools that could create that sense of joy and that sense of collective grief for them, and just honoring what the feelings were and not looking beyond it, because it was really hard for our families to think about the tangible things when there was just so much ruckus going on up here too. So that's for us was really just highlighted a lot.
I will just say one thing, and this is not, this is just to add on to what you said with mental health. A lot of it is, sadly warranted. I mean, it is a very difficult situation for a lot of people. And I think that the better we can get at coordinating and providing resources, that will also help their mental health. Because for a lot of people, the reason they're suffering mental health is because they don't know whether where their housing is going to be. They don't know, if they're going to have a job. So these are interrelated much more than we think. Like if people had more of a safety net, had some security that come the COVID-19 reopening, they would have their job, their housing is secure. A lot of those mental health issues would go away. Not of course, the other issues with family members, but that only compounds it, because as they look to their future, for them, unless we give them a lifeline, it can look pretty bleak.
Absolutely.
Yeah, I think so much of it interrelates, like you're saying, housing, employment, healthcare. Maggie, it's a really excellent point about healthcare in general. COVID has really dominated healthcare for the past year, and we need to recognize that the people in our community have probably deferred a lot of critical healthcare needs, haven't gone to the dentist, haven't looked after things because they've been apprehensive about going to a medical facility. There's going to be a lot of catch-up work when it comes to that, but I think that, Michelle, what you were saying, the point that you were making was so beautiful, just in terms of providing opportunities for connection and joy. It's been so bleak for so long. What people really need is that uplift and the connection. And if we can model ways of doing that safely, because this crisis is not over. There is a possibility of a second surge if we're not careful. Vaccination only protects you, it doesn't protect the spread. And we need to educate people and stay safe while we're bringing people back together.
That's it.